Hi everyone, this is All Things Lymph, and I'm back. I've worked all week on looking at those 98 symptoms that we talked about in the previous video. That was from Survivor Core, and let me just see if I can get that pulled up here. That was the one that had the COVID-19 long hauler symptoms in the report. It was a survey report that was out July 25th, 2020. And they had a bunch of long haulers had listed all their symptoms. So anyway, we talked about that in the previous video, and I took all those symptoms and I went through and I looked up everything to do with the lymph system and what kind of symptoms does a person have when their lymph system is clogged. So when I looked all of that up, I ended up making a little report about that. So let me get back to that, and I will minimize this and we can look at it. Here's the report that I did up. Now this is going to be a working report and a working document, I guess. You might call it a living document. And so what I'm going to do here is I looked up a bunch of articles on the internet. I found journal articles, medical stuff, medical journal articles, but I also looked on different websites and things like that, trying to find as much information as I could about the lymph system and what kind of medical problems does it cause, what symptoms do you have with each different part of the lymph system itself. So when I looked, I ended up taking all of those 98 symptoms and I put them in a chart, and I'm going to show you those right here. So what we have here is a little chart, and what I'm going to do is I'm going to put this document in the description box. So this is a PDF. You guys can, anybody who looks at these videos, you can print this PDF off. You can use it yourself. It's going to have all of the treatment that I'm using for long haul COVID in it, and then it's also going to have this information here. And what I'm going to do is I'm just going to keep adding to this document, and then every time I do a video I will give you an updated version. If there's new information, if there's more information that I've added to it, then I will give you the updated PDF for this document. So it's going to be changing through each video. You'll have more information on it, and so you can print it and use it for your own means. Use it for educational purposes if you want. I will have it locked as far as changing it, so nobody will be able to change it, hopefully, if I've done that correctly. And but you can print it off and you can read it, so you just won't be able to change the words in it. But anyway, I will share this on every video that I do from now on, and in that way, if there's new information, you've got that new information. Now I can keep everybody updated. So here we have Survivor Core's symptoms. I took the symptoms, I put them in a chart. Now every symptom has a number in parentheses, and you'll see that on there. So for instance, like cough or fatigue, fatigue under lymph nodes, system, brain, lymph, and thymus and appendix. That one has 1,567. So that was 1,567 people that said they had fatigue as part of the long haul COVID symptoms. So you get the idea. Anything in the parentheses for the numbers is telling you how many people from this survey, the Survivor Core survey, had those symptoms. So you can see which symptoms were more and which ones weren't as prevalent. And then what I did is I put them in a chart and listed them according to the different parts of the lymph system. So in the first column right here, we have lymph nodes, system, brain, lymph, thymus, and appendix. Those are all organs and systems in the lymph, as part of the lymph system. We do have lymph system around our brain in the dura mater, like I've said in previous videos. And so the lymph system goes from head to toe. We also have, I think, some of the lymph is extending around the scalp area too, on the outside of our skull, underneath our skin, underneath our scalp and hair. So anyway, and then we've got adenoids and tonsils, we've got spleen, we've got liver, bone marrow, Peyer's patches, which are in the small intestine, the mesenteric lymph nodes, which are also part of the intestinal area, abdominal area, and then the cardiovascular symptoms. I have a column for the cardiovascular symptoms because, as we talked about in the previous video, they are pretty much, researchers have found that that COVID-19 is not a respiratory virus, it is a cardiovascular virus. So both of those symptoms lie together in the body, and so the lymph system is head to toe, as is the cardiovascular is head to toe, but it is lying next to each other. So the lymph system extracts all of the dirty stuff out of the blood from the cardiovascular system, if you recall from the previous videos. So what the proteins for the COVID-19 virus is doing is the proteins are breaking off and the virus is getting shed out of your body. The proteins are staying in your cardiovascular and lymph system. So it's the proteins are blocking in a lot of us who have the long haul COVID. I believe that's what's going on. It's blocking both of those systems in certain areas. It's not in all the areas. And that's why we have some of the symptoms that the long haulers were saying was that it's their symptoms of long haul COVID is changing. It's morphing. They might have lower back pain one day, and then a few days later, maybe their upper back hurts. Well, why is that? That's because the inflammation in your immune system, in your lymph system, is such that maybe some of that protein, the lymph system moved it because it's circulating it through the body. Maybe it put it back into the blood, it came back through, and it's in the lymph system again. Maybe it's just stuck in the lymph system, and then it's moving through the lymph system. And as it moves through the lymph system, maybe it's getting stuck at another node, at another lymph node in another area of your body. So maybe the lower back is hurting, and then maybe your knee is hurting the next day. Maybe your ankle is hurting. Maybe your foot is hurting, depending on where the proteins are getting stuck at whatever place in your lymph system. So when we go through here, we've got fatigue for under here. We've got muscle or body aches. We've got difficulty concentrating or focusing under the lymph node system, the brain, the lymph, the thymus, and the appendix. I grouped those all together because the thymus didn't have too many symptoms that I found out of the 98, and neither did the appendix. And the brain, essentially, when it comes to the brain lymph system, because that was discovered in 2017 by researchers out of Virginia, and because excuse me, because that is so new of a discovery that there's not a whole lot of information about what symptoms you have as far as if something happens to the lymph system in your brain. Now, I put all of my research articles and different things that I looked at the end of this document. So when I post this in the description box, you're going to be able to look at all of those links at the end of this document. So you want to print it off, look at those links, or, I mean, you don't have to print it off. You can look at it on your computer, obviously. And then on the computer, you'll be able to click on the links, and then it'll just take you right to those documents because I put them all in the document itself at the end. And I do have all of that in there so that you can look at that. And as far as, I think I put one in there for the brain is when it was discovered, I think. If I didn't get that one in there, I will get it in next time. But so as we go down this document here, you can see in the cardiovascular, there was shortness of breath, difficulty breathing. Anything to do with cardiovascular, I put in the cardiovascular column. Although you need to keep in mind that a lot of these cardiovascular symptoms, they can also be occurring from congested lymph, from the lymph system also being congested. So they're not particular to cardiovascular, but the reason why I did make a column for cardiovascular is because both of those systems work together. You really cannot separate them out. If one is having problems, the other one is having problems. So they're working in tandem. And the other thing that you need to keep in mind is the medical community does not recognize, the traditional medicine, they do not look at the lymph system. They look at your symptoms of what you're having in the different parts of your body, and then you are seeing a doctor for that specific part of your body. they're more than likely, they won't recognize any of the symptoms as something that they need to send you to a lymphologist or an immunologist or a doctor for that. And we'll talk about that in a little bit here with a couple of the long-haul COVID clinics that I brought up on the internet there, so you'll be able to see what exactly they're doing and how they're kind of setting that up for long-haul COVID patients. Now, the Peyer's patches, the mesenteric lymph nodes here, this is dealing with your intestines, and as you can imagine, that's going to make your stomach hurt. You're going to have diarrhea, you're going to have the nausea, you're going to have the vomiting. When it comes to bone marrow is a part of your lymph system. It is considered part of that. And when your bone marrow is inflamed, you're going to have joint pain, bone aches in the extremities, you're going to have hand or wrist pain. The liver, this one here is difficulty sleeping. There's other ones too. We'll scroll down here and look at some other ones. The spleen has, you can have reflux or heartburn from that. You can have partial or complete loss of sense of taste. You can have upper back pain for the adenoids and tonsils in your throat. Most of us are familiar with all of that because we've had colds, we've had sore throats, we've had strep throat, we've had all those different kind of viruses and stuff and infections growing up as a child. So everybody pretty much, I think, knows probably most of those. Sore throat, partial or complete loss of smell. Your smell is related to the adenoids and tonsils as well. The taste, surprisingly, is related to your spleen and also somewhat to your liver. So some of this here, it's really surprising as to what these lymph organs actually affect in your body. And then you have muscle or body aches is just general. So the lymph node, system, brain, the lymph, thymus, appendix, anything neurological is going to be in this column with the brain. It's going to be just general, that people consider general symptoms that come up when your lymph system is in overdrive or when it's trying to fight off something that's in your body it doesn't want in there. So difficulty concentrating or focusing, that's a big part of it too. But a lot of these neurological ones too, with the concentration, the focusing, I put them in this column because of the brain. But also know that and understand that the liver also does have effect on concentrating, focusing, memory, all of the same things that you're going to find for the brain. The liver is also in concert with that. So we're going to go down a little bit here. Anxiety was a big one for cardiovascular. If you have cardiovascular issues, anxiety was listed as part of the cardiovascular symptoms because people have trouble breathing and things like that. But do note also that with the lymph system, when you have fluid built up, a little bit of swelling going on in different locations and different organs of your lymph system, that can also cause swelling. If your spleen is swollen up, it can cause fluid around the heart. So when you bend over, one of the symptoms on here was bending over, getting dizzy or having chest pain when they bend over. Well, if you've got fluid from your spleen causing fluid on the heart, when you bend over, some of the similar things that you have from cardiovascular stuff from having to do with the heart is going to be happening as well. So some of this is just overlapping. Okay, so again, inability to exercise or be active, that's all cardiovascular, persistent chest pain or pressure. But you can also have this one here from the spleen as well, causing fluid. Let's see, and then we're going to keep going down here. Memory problems, headaches, all this dizziness and everything. I put those here. I did put heart palpitations. I did not put that in cardiovascular. I put it over here in the first column with general symptoms of immune lymph system being inflamed or inflammation because it is listed multiple times, the heart palpitations for the immune system. So I did go ahead and stick that in there, but everything else having to do with vascular or the heart, I put it over here in the right column in the cardiovascular column. However, like I said, just realize that some of these are overlapping. So we're going to go down here too, and of course you can see with the adenoids and tonsils, the smell goes along with that, the phlegm in the back of the throat, the congested or runny nose, the clogged ears, that's all going along with that. And we know mostly that with anything to do with our throat or ears, it's going to do that. And then, let's see, your hand or wrist pain, foot pain, that's going to go along with your bone, with the, what was it, your bone marrow. So the bone marrow's got the bone aches in the extremities, the hand or wrist pain, the foot pain, and then again in your the Peyer's patches, the mesenteric lymph nodes, that's your diarrhea, abdominal pain, nausea, or vomiting. And then you've got, let's go, just keep going down. We've still got a lot of the other symptoms here, but some of those smaller lymph organs, they kind of peter out because not as many symptoms are going to, you're not going to have as many symptoms for some of those smaller organs. And again, we keep going here with the high blood pressure and all that. But I found multiple articles that the lymph system can also cause high blood pressure. Why? Because anytime you have inflammation going on anywhere in your body, it is right next, the lymph system is right next to your cardiovascular system. So it can put pressure on veins in various parts of your body, causing your blood pressure to increase. So again, high blood pressure, I put it on the cardiovascular side, but it can also be in just general overall symptoms for inflamed lymph system. So the jaw pain, that can also occur with your throat and adenoids and everything, because when those get inflamed and the lymph nodes along the jaw get inflamed, you can have jaw pain. So the changing symptoms, that's part of the lymph system. Lymph system is definitely a changing system because it's moving fluid through there. It's trying to move it through. So the symptoms can change as you go along, depending on maybe one day, one area of your lymph system is more swollen than another day. And so you might have pain in that area and then you wouldn't have it on maybe the next day it goes away a little bit. And then, of course, we keep going down here, the hormone imbalances, the kidney issues, or the protein in the urine, that's for the liver. So all of that there, you can see liver really affects a lot, and it has effects on your hormones. So, you know, some of the long haulers has stated they have the hormone imbalances. Well, of course, because the liver's got problems. So, and then we keep going down here. The syncope is fainting. So some of the people said they had some fainting, sleeping more than normal. This symptom here, the sleeping more than normal, I really felt like that pretty much goes with fatigue, which is at the top of this column for the general lymph systems, because really when you think about it, sleeping more than normal, well, of course you're going to sleep more than normal because you are so tired. You're so exhausted from the long haul COVID that you have to sleep more. You don't have a choice pretty much because you're so fatigued. And fatigue is if you look up the definitions, it's listed as exhaustion too. So, but you can also have humming in the ears, floaters or flashes. And then I also wanted to get down here too, because the general lymph system symptoms keep going on. Your confusion, the muscle twitching, and you have muscle twitching because you have the lymph system is swollen and it's pressing on your muscles and causing problems there. You got swollen hands or feet, mouth sores or sore tongue. It can cause that. It can cause extreme pressure at the base of the head or the occipital nerve. I have an article I'll show you about a lymph node that was swollen in the brain there, or swollen at the base of the skull, and it put pressure on the occipital nerve, so the doctors removed the nerve. Not in a long hauler patient, but just in a patient. I just wanted to, I'll show you that here in a minute, and you can see what I'm talking about. Swollen lymph nodes, brain pressure, costochondritis, the bulging veins, eye stire infection, UTI thrush. They can all be caused by the lymph system because it affects UTI. Obviously, your kidneys can be affected by the lymph. Personality changes, drastic personality changes, yes. There was some articles, and I don't know if I put that in this document. I will try to find that, and I will add it for next time, but I might have put it in there already. Personality changes they found that with the inflammation on the brain, people with the long haul COVID and or COVID, they will have drastic personality changes because essentially, I mean, if you think about somebody getting in a car accident with traumatic brain injury where they've hit their head and their brain kind of swells up a little bit, well, think about it in the opposite fashion where your lymph system around your brain, in the meninges around your brain that surrounds it, that's being inflamed. And then the inflammation of that lymph system around it puts pressure on your brain. So then it changes the personality of the person because they've got that inflammation going on. I think in a lot of the cases it was just acute where it eventually goes away when the inflammation goes away. But if it's sustained for a long period of time, you could have possible brain damage from that. Okay, so elevated thyroid was all part of the general symptoms as well because the inflamed lymph system can affect the thyroid. And what it does is it brings the hormone in the thyroid gland down and or up. And then it can make it go either way. And then you've got problems with thyroid from the inflamed lymph system. Now these last symptoms that I'm going to tell you about, this dysesthesia, symptoms of lymph node system inflammation, it can cause compression of nerves of your central nervous system, your spinal cord, and your brain. So when you go down here, these last symptoms some of these symptoms that were listed in that survey was hair loss. Oh, sorry there. I see I put it hair loss. It's supposed to be hair loss. I'll fix that before I put it in the description box. But so it's hair loss, neuropathy in feet and hands, nerve sensations, feeling of burning skin, burning sensations, painful scalp, herpes, I think this is Epstein-Barr virus, the EBV, or trigeminal neuralgia. All of these symptoms are grouped. They are grouped according to this term here, which is this dysesthesia. They're all part of that dysesthesia, symptoms of lymph nodes. So, and the system of inflammation. So, they're all in that grouping. If you look up that word, dysesthesia, if I'm saying that correctly. If you look that word up on the internet, you will find these symptoms right here, and they can be caused by inflammation in the body from the lymph system. So there are other reasons they can be caused, but you know, after you go through these symptoms and you start grouping them, you can see that almost every one of these symptoms can be attributed to the lymph system itself and its organs. And I think I only ended up with 19 symptoms in the cardiovascular column. So 19 symptoms in the cardiovascular column out of 98 from that survey. I think this right here shows that doctors need to be looking at the lymph system and they need to be helping patients get the proteins out of their lymph system. Like I said, with the treatment I'm doing, within 3 weeks, I had relief. I had my spleen draining out, and all of the lymph on my left side drained when that spleen drained, and all of the pain and everything that I had was able to start going away at that point. And so anyway, I went ahead and let me scroll down here a little bit farther. I did general symptoms of lymph system inflammation congestion because that chart only contains the 98 symptoms that the long haulers reported. I went ahead and I put all of the symptoms that I found for the inflammation of the lymph system down, just the general symptoms, and then I broke it down according to your appendix, your liver, your thymus, everything. So as you can see, it's a pretty long list. So you can go through these, and the liver inflammation, the liver is huge. That is one everyone needs to be looking into. The liver causes all kinds of problems and insomnia, waking between 1 and 3 a.m. So the sleeping problems that people were reporting from the long haul COVID, stomach ache, sluggishness, depression, anxiety. It's got one of the telltale signs if your liver is clogged up is skin problems. All kinds of skin problems come from the liver. And then the bitter taste in the mind or in the mouth. You can also have weight gain. Your gallbladder can seemingly feel like it's acting up, but because it's affected by the liver. But it can also, you can have soreness on the abdomen area, particularly on the right side. You might bruise easily. There's brain fog, confusion, forgetfulness, inability to focus, moodiness, vertigo, weak resistance to disease, red and itchy eyes, bitter taste in the mouth. So, people reported having eye problems. That's one of the things there. The spleen. The research I looked at said that sometimes the spleen is said to be the largest lymph node in the body. The spleen is huge. Remember when we talked last time, I'm pretty sure we talked about the blood clotting, that they found that COVID was a vascular problem and that there was problems with blood clotting. Well, guess what, guys? The spleen affects blood clotting. So you've got blood clotting going on from the cardiovascular system, but you also have issues with blood clotting when it comes to the spleen. It says decreased immunity, important role in blood clotting. It plugs leaks in the blood vessels. So if your blood vessels are getting havoc wreaked on them from the proteins breaking off of the COVID virus, then you have your immune system has to come in and help with that. They have to plug the leaks. They assist in that blood clotting. The spleen also holds 40% of the total your blood platelets mass in the body. That's a lot. So it makes you have GERD. They found that a lot of people that are having GERD and heartburn, it is affected by the spleen, is a culprit in that, and it helps with that. So if it's plugged up, it can cause those problems, the GERD, the heartburn, decreased taste sensation. It does also affect the taste along with your adenoids and tonsils. So nausea, everything. It can have abdominal pain. You can have abdominal pain around the heart area. You can have the in the abdominal area, the upper left side, all this kind of thing. Notice here your edema, fluid buildup in the extremities or around the heart. So it affects all of that. You've got your appendix, which is if you've got pain in the lower right side of the abdomen. And what they found with that is that the feelings or the general feeling of being unwell, but also the pain and everything can come and go. So not every time a person's appendix hurts are they rushed to the hospital and the appendix is removed. That's only if it's, burst or something. Then the thymus is decreased resistance to infectious diseases. It's muscle fatigue, drooping eyelids, difficulty breathing, loss of appetite, weight loss, headache, swelling of head, face, or neck. You could even have bluish color to skin. The tonsils, I'm not going to go over those. Most of that everybody knows. And then the adenoids cause all kinds of problems with your smelling and runny nose, all those common ones that they list as part of COVID, especially when you get when you first have COVID. But those symptoms continue on. And then we've got bone marrow, swollen bodily joints, painful joints, warm to touch joints. Most common joints and bones are lower extremities, hips, knees, ankles, feet. But again, it affects all the bones and the joints, causing bone pain and joint pain if that is swollen up, or if you've got, like I said, the proteins from the virus in there. The Peyer's patches, they are considered to be the immune sensors of the intestines. They are the gut-associated lymphoid tissue, and they consist of both isolated and aggregated lymphoid follicles. But it's considered one of the largest lymph organ and contains up to 70% of the body's immunocytes. So it can also cause diarrhea and abdominal pain. I didn't find much on the Peyer's patches, guys. It was very, very difficult to find any symptoms at all. They have a lot of research on it, but they don't talk about the symptoms of what happens when it's got problems. The mesenteric lymph is along the lines with that Peyer's patch, and that's also to do with the intestines and the abdominal area. So it causes fever, nausea, vomiting, diarrhea. Complications may cause upper respiratory infections. So, and you'll have pain in your abdomen. And then the brain lymph, like I said, was discovered in 2015 to 2017. Inflammation causes brain swelling, but it's basically going to cause any kind of neurological deficits, your brain fog, confusion. And then there are researchers who report implications for Alzheimer's, dementia, and autism with the brain lymph. So anyway, that is all that information. Now, at the end, of course, are all of the links. So go ahead and click on those links, and you can look up some of this. I did make notes in some of the links where it didn't come right out and say what it was talking about, so I put some little notes on some of them to make it a little bit easier so you know what they are about, or what I found in them. So that is that document, and I think what I'm going to do, guys, because I'm already at 30 minutes, and I don't know if this, when I copy this video onto the computer to publish this on YouTube, it usually won't let me go much over 30 minutes. So I'm going to stop here, and like I said, I will post this in the description box, but I'm going to stop right here, and we will go over the rest of it, where I want to show you some different articles, the continuation of this, in the next video. So this will be part 1, and I will post a part 2 as well. All right, I'll see you in part 2, or I guess talk to you in part 2. Bye for now.